Alright, so today we're going to do a PICC dressing change. It is done under sterile technique. This is what your PICC line is going to look like when you get it. You'll have PRN adapters on the end and your lines should be clamped off because PICC lines are sealed with positive pressure. So this is what your dressing should look like, and you're going to get your kit. The kit looks like this, and it'll actually say PICC change kit on it. These are stocked in your supply room. Before you do anything, you have to wash your hands. So you come into the patient's room, you introduce yourself, let your patient know what you're going to be doing for them. We're going to be doing a PICC dressing today. This gets changed every 7 days, sir, so I'm going to get this taken care of. That way you'll be able to go home with your PICC line today. Are you okay with us doing the dressing change? Your patient should respond with yes. If not, then ask them what concerns they have, address those concerns, and then proceed with the dressing change. Once you get the okay from your patient to go ahead and do the dressing change, verify that it is the right patient, name, date of birth, and have the patient recite back to you what you're going to be doing so that you can make sure they understand the procedure we're getting ready to follow through with. Once you've got all of that covered, then go over to the sink, excuse yourself for a moment, and wash your hands with soap and water. You wash your hands every time you do a dressing change. And then after we get our hands washed, we're going to come over and we're going to open up our kit. Like I said, PICC change tray, flip it over. You're going to peel from the corner and you're going to peel up and off. Take that top flap off, pull your PICC kit out. You can touch the outside of this kit. That is okay. When you flip it over, it gives you directions. It immediately starts tear here. So you're just going to follow this step by step, exactly what it tells you to do. We're going to go ahead and tear here like it says, and we're going to open up our kit. So when we open it up, the first thing we're going to see is we're going to see removal. All right, this is what we're going to put on to remove the old PICC dressing. So we're going to start with this. Pull it out. When you open this up, there should be 2 masks. Voila. And a pair of sterile gloves and some hand gel. All right. Go ahead and give one of these masks to your patient. Boom. And then you're going to apply a mask also as well. Go ahead and get your mask on before you glove up. Open your gloves just like you would if you're doing a sterile technique. Get your gloves ready. Like so. And get your hand gel out. Now you're going to use a hand gel every time. There's 2 packages of hand gel in here. Get your hand gel going, clean your hands, let it dry. The gloves in here are a little small. I would say if you wear anything size 7 or bigger, you want to get your own sterile gloves out of the supply room. I always have to get my own sterile gloves. I am going to try to use these gloves for demonstration today, just to show you how the whole kit flows. Gotta let my hands dry. Do not wave your hands back and forth in the air. We don't want to fan them. We let them dry, just holding them still. I like to squeeze them together like this to see if they're still sticky. When they're not sticky anymore, then it's okay to put my gloves on. Put your gloves on just like you would if you're doing sterile. And I have some residual from the gel on my hands. And I might tear the glove while I do this. There we go. Alright, let's get a second glove on. Alright, so now this is trash. So if you take a look at our dressing here, you're going to see there's 3 strips. There's a strip that goes over the top, so we're going to remove that first. Remove that top strip. Alright. Like so. And then underneath that, this is what we call the pants, because it looks like a pair of pants. It has a little slit in between the middle of it that goes around. So you're going to have to remove this piece. So you're removing 3 pieces when you remove the PICC dressing. And then we're going to take the PICC dressing itself off. And you're doing all of this with that first pair of sterile gloves that you get out of your kit. And always peel towards the insertion site. Never peel backwards, because if you peel backwards, you can pull that PICC line out. So once you get your dressing off and you have your stat lock in place, pay attention to your mark. We have 0, 1. So this PICC line is showing at 1 centimeter. If your PICC line was to come out and you would have 2 centimeters showing, and on the wall, on the paper, it says 1 centimeter, that means that line has been pulled more than 1 centimeter. If it's been pulled more than 1 centimeter, redress it where it exists. And then you'll have to get a chest x-ray to make sure the tip is still located in the mid to lower SVC. So anything greater than 1 centimeter length out from what is listed on the wall, you have to get a chest x-ray to verify placement. Alright, so once we get this off, we're going to snap our butterflies open. They open this direction here to the right. This one opens up to the left, just like a little door. Lift up your catheter and pull off our stat lock. And you want to do this without pulling your PICC line out, and this can be a little bit touchy here. I pulled a couple PICCs out. If you pull it out, remember, just get a chest x-ray. It is not uncommon. If you do several of these, you are going to eventually pull one out, 1 or 2 centimeters. Just follow through with the proper precautions. Now this is where, when I'm standing up, I like to brace my hip against the hand to remind the patient not to move, or I'll work like this with a palm on the elbow. Some people will take a piece of tape and tape the hubs down right here so that if the patient moves, the line doesn't come out. Anything you need to do to keep this line from moving, you're going to do. It is up to you. Everybody has a different way of doing things. Once we get our old dressing off, we're going to take our first set of gloves off and let our hands dry just a little bit. Then we're going to go down to our second location on our line, and it says application, set aside gloves, and hand sanitizer. Let's go ahead and pull our gloves and hand sanitizer out. Oh, hand sanitizer is inside the package of gloves. All right, so we're going to set these to the side. Then you're going to open up your kit like it's a sterile field. Once, pinch on the outside because you can't touch the inside of your sterile field, so pinch on the outside and open twice. So this is what your kit looks from the inside. So what we're going to do is this is your scrub that we're going to scrub for 30 seconds, and then we're going to let it dry. On here it says to dry is 30 seconds. According to AVA and INS, they want you to wait 3 minutes for dry time. Then we're going to apply our no sting barrier. Once our no sting barrier dries and becomes tacky, then we're going to apply the stat lock, and then we're going to put on our CHG dressing. And once we get done with that step, then we can go ahead, initial time and date. This is extra supplies if you need it. If the site starts to bleed, you've got some gauze. If you mess up the little adhesive tabs on your CHG dressing, they give you 2-inch nylon tape to secure with. And then you have a pair of sterile tweezers in case you need to remove some debris from around the insertion site, because dried blood will grow bacteria. So we're going to go ahead and open up our hand sanitizer as soon as I find that spot, and we're going to sanitize our hands again. This process seems like it's taking quite some time, but once you start doing this, you will be able to do a full dressing change in 5 minutes. Make sure our hands are good and dry before we put on our gloves. Alright, so our hands are dry. We're going to open up our second set of gloves, and we're going to open it up off of our sterile field. Go ahead and slide that open. And we're going to apply our gloves to do our dressing change. And I just dropped a sterile glove. So if that happens, do not panic. You can call somebody to come in and bring you another set of sterile gloves, which is what I'm going to do. Hey, Peg, would you mind dropping me a size 8 sterile glove, please, on my field?
I would love
right
to.
Here.
I'd love to.
You are going to drop things. Do not panic. Just start over or have somebody bring you another sterile glove. I'm picking up my gloves without touching the inside of my sterile field. And we're going to go ahead and put these on. Alright, so now we're bringing our sterile field back over. So now we're going to get ready to take care of the site. Pull your chlorhexidine scrub out. Now remember, I'm going to use this as my non-sterile hand and support my PICC line. I'm going to take my chlorhexidine and I'm going to scrub the site. And while you're scrubbing the site, make sure you get over the PICC real good, go under the PICC, around the PICC, and we're going to scrub for 30 seconds. You want to hashtag back and forth, up and down. Alright, there's our 30-second scrub. Now we're going to let this dry for 3 minutes. Okay, so our 3-minute dry time is up, so now we're going to apply our no sting barrier. We're going to no sting barrier, we're applying. And we're going to go up underneath. We want to get all the area that is actually going to come in contact with the chlorhexidine dressing to create a barrier.
Ready.
All right. So now we're going to wait for the barrier to dry. Then we're going to reach in here and grab our stat lock. I'm going to pick the stat lock up. Anything I touch with this hand goes over here in the trash. All right. Then we're going to set this up underneath here like so. And my lock is stuck. And this is going to happen to you. There we go. Pop the lock open. These little blue tips go inside these little holes on the purple tips. It's a booger getting them in there sometimes. There it is. All right. Flip that on over. Snap it down. Flip this one on over. Snap it down. They are a little hard to snap down. For your dressing, you do not want to touch the insertion site with this hand, but you can touch the dressing. Snap this side down. All right, get rid of these two pieces. Then we're going to pick up our CHG dressing. Hold the back piece. And grab your two side pieces like so. You want to set this on there, however much is hanging out. This has to be in the middle of your CHG dressing. Your insertion site goes in the middle of the chlorhexidine pad. It doesn't matter if you have 6 centimeters of PICC hanging out. This has to be in the center of your chlorhexidine pad. Press your edges down like so. And then you're going to peel your paper off like so. And nothing has to be sterile anymore. The dressing is covered with the CHG. On the one side of your CHG dressing, these are your pants. We call them a pants because they have a little notch in them. Looks more like shorts. See? Now they're fat man shorts. That's the kind of shorts I wear. Alright. Up underneath here. Make sure you straddle your PICC line. Pull the two little dog ears off. And then we're going to take this piece here. Some people will actually fill this portion out before they put it on. They find it easier, but I don't write on this. I like to write on the dressing by itself. Take the dog ears off, smooth that down. Then I grab a marker. Today is 7/17. It is 14:30. And that's me. And that is a completed dressing change. So if you have any questions or any concerns about PICC line dressing changes or any other type of vascular access devices, please give the vascular access team a call. Put in a request under IV Therapy Consult, PIV, in Power Orders and type in what you would like us to know, and we will call you back.